I'm Anita Dust, and I agree with you, Rose. It felt like the three of us knew each other forever once we did that first session together. And as I was getting ready today for this, I thought, it's been a week since I've seen them. I think I've missed them. And I feel like I've made new best friends, which has been awesome. But it was my first Parkinson's policy forum. I had the good fortune to be invited by the Parkinson's Foundation. And I didn't even know what I was saying yes to, but I just felt like I needed to say yes. And I went into the sessions and listened to Gentry's and Sara's stories and tried not to cry, which I made it through without crying, but I wanted to because they're so touching. But when I started to speak, then I focused on the facts, meaning that I wanted the Congress people to know more about the details of the disease. And I started out telling them it's the fastest growing neurological disease in the world. There are over 1.1 million people in the US with Parkinson's, 90,000 newly diagnosed every year. And that number is up from 60,000 from a previous 10-year survey. And that's a 50% increase over 10 years. And worldwide, there are over 10 million people with Parkinson's. And that is expected to grow to 25 million by 2050. And the economic impact is horrific. It's currently 82 billion and expected to hit 112 billion by 2045. And despite these scary statistics, I'm really concerned that Congress will not give it the appropriate attention until the public gets behind it. And the reason I say this is that Congress gets many requests and they all sound very important when being presented to them. So how do they decide what to focus on? And to a great degree, it depends on what the majority of voters want. And I'm not saying that in a negative way, just as a fact. And I can give you two examples from history as to why I say that. The first one is AIDS. The first case of AIDS was in 1981. And by the late 1990s, research stopped AIDS from being a death sentence. And in the early 80s, breast cancer felt like a death sentence. Within about 20 years, that changed, and the 5-year survival rate rose to over 88%. And the reason these two diseases were turned around relatively quickly is due to people getting behind them. In 1987, over 500,000 people gathered in the National Mall in DC to support the need for AIDS research. And think of the pink ribbon. Everybody knows what that is for breast cancer. The public support resulted in dramatic increases in government funding. In fact, still today, breast cancer receives $750 million per year, and AIDS receives over $3 billion per year. Parkinson's has been receiving $250 million. And we were supposed to ask for $600 million when we talked to the congressman. But I personally didn't think that was enough. The increase to AIDS last year was $659 million. That increase was more than the amount that these organizations are asking for with $600 million. So now maybe AIDS really needs that money. I have no idea. I'm sure they use it well. But I'm not here to say whether they do or not. But what I can tell you emphatically is that we as Parkinson's patients need it. Parkinson's has been around for over 200 years with very little progress. Even the diagnosis of it is trial and error. The way I figured out that I had Parkinson's was due to a flyer that came in the mail from the Parkinson's Foundation. It was called 10 Early Signs of Parkinson's. And considering that it was junk mail, I started to throw it away. Fortunately, I noticed one of the symptoms and thought, well, I have that one. So then I read it through thoroughly and realized that I had 4 of the 10 symptoms. But that started the process of me going to my family doctor, who sent me to a neurologist. And the neurologist was not sure if I had it. He said, maybe you do. But he did recommend that I call a movement disorder specialist right away. He said, do it soon because it will take a long time to get in. And he was right about that. It took 6 months to get an appointment. But I still consider myself lucky because I live in a city with movement disorder specialists. Many people do not. There is a shortage of movement disorder specialists. And I was lucky again, because that process only took a year from the time I received that flyer in the mail until my official diagnosis. And a year might seem like a long time, but for most people, it's an average of 3 years, and not uncommon to be 5 to 10 years because it's so difficult to diagnose. And the best advice that the movement disorder specialist gave me was to start going to Rock Steady Boxing. Rock Steady is a non-contact boxing and full body workout designed for people with Parkinson's. It was started by Scott Newman, who was a Marion County prosecutor in Indianapolis, with a promising career when he was diagnosed with Parkinson's at age 40. Fortunately, he did not follow his doctor's orders for very long, because his doctor told him to go home and do practically nothing because he might hurt himself. But instead, he listened to a friend of his who wanted him to go to the gym with him, and they started working out, doing boxing and different workouts. And Scott noticed that within a short period of time, his symptoms improved. He was getting better. So despite resistance from the medical community, he persisted, and today there are more than 800 Rock Steady boxing facilities in the world. And again, I'm lucky. I live less than 10 minutes from the world headquarters of Rock Steady Boxing. I'm able to go 3 times a week, and it's a great place. And I've made the statement before, I would give up my medication before I give up Rock Steady. At this time, my only hope is to keep exercising relentlessly. And when that is no longer enough and the symptoms progress, I can have DBS. DBS stands for deep brain surgery. That's where they open your skull, insert a device, and they prefer to do that while you're awake. It is a very effective surgery, but the thought of doing that scares me quite a bit. So lastly, I want to emphasize that we have to stop viewing this as an old person's disease. Up to 20% of people with Parkinson's are under age 50. And remember, I said Scott Newman was 40, Michael J. Fox was 29, Brian Grant, an NBA player, was in his 30s. David Spinney, a professional cyclist, was age 40. And I could go on, and that's the only people that are famous and been heard of. There are many people that we all know. In fact, 2 of them are talking to you today. Those under 40 when they were diagnosed. So it's important that we stop thinking this as an old person's disease and get Congress to do something about funding to help us.